Okay, good morning and welcome to this virtual symposium of the National Academy of Medicine's Action Collaborative on Countering the US Opioid Epidemic. My name is Elizabeth Finkelman and I direct and oversee the work of the Action Collaborative on behalf of the NAM. You will learn a little bit more about the Action Collaborative in a minute, but first I'm going to describe our agenda for the day. Next slide, please. Of course, under normal circumstances, we would be convening today's symposium in the auditorium of the National Academy of Sciences building in Washington, D.C., but we're delighted that we're able to bring you this program virtually today. During today's virtual symposium, Action Collaborative members and invited expert speakers will address among the highest priority elements of the nation's response to the opioid epidemic and how the convergence with the COVID pandemic is impacting patients, families, the health system, and the ways in which we may grow, adapt, and innovate in the wake of it. Our program will kick off in just a moment with opening remarks from the Action Collaborative's co-chairs, including Dr. Victor Dzau, who is the president of the National Academy of Medicine, Ruth Katz, who is vice president and executive director of the Health, Medicine, and Society program at the Aspen Institute, and Dr. Jonathan Perlin, who is president of clinical services and chief medical officer at HCA Healthcare. Unfortunately, today we will miss hearing from our fourth co-chair, Admiral Brett Dzau, who is Assistant Secretary for Health at HHS, as he is on the front lines of the government's response to the COVID-19 pandemic. Following the co-chair's remarks, we'll move into our keynote presentations, which will feature the stories and perspectives of two shatterproof ambassadors who will speak to the ways in which stigma towards addiction has impacted them and their families. Following our keynote presentations, the remainder of the day will be structured around 5 70-minute sessions that cross-cut the Action Collaborative's priority focus areas, which include strategies and opportunities to overcome the stigma of addiction, strengthening health professional education and training, accelerating person-centered and evidence-based pain management, elevating promising prevention strategies, and building the essential elements of a health system that is equipped to prevent, treat, and manage opioid use disorder and other substance use disorders. Each session will begin with brief remarks from the panel moderator, followed by short presentations from the panelists, and then moderated discussion and Q&A with the webinar audience. The entire symposium is being recorded, and a full recording of the event, along with speaker presentations, will be posted to the Action Collaborative website in the coming days. Next slide, please. We hope you will join the conversation on social media over the course of the day and tweet, over the course of the webinar by using #OpioidCollaborative. Next slide. And then finally, before I wrap up, I do want to conclude by acknowledging and thanking the sponsors of the Action Collaborative who make our work possible. They are all listed here on this slide for you to review. And now I'm really pleased to introduce Dr. Victor Dzau, president of the National Academy of Medicine, who will lead off the opening remarks from our co-chairs and share some background about the Action Collaborative. Dr. Dzau, over to you.
Well, good morning. It's great to see all of you and welcome to the symposium. We're going to deal with a crisis, an epidemic, the midst of a pandemic called COVID-19. But we just want to make sure we bring back to in fact, your radar screen, the issue of the opioid epidemic. And so this symposium will address many aspects of this, but I'm going to tell you about the Action Collaborative, which is in many ways bringing together the many pieces that we all are trying to tackle with the opioid epidemic. So let me begin with the first slide. Next, please. So this is a crisis, and you know this already. Over 130 Americans die every day from, in fact, overdose, and about 70,000 of the deaths are from overdose. And in fact, there's 21 million people with an opioid use disorder, and this crisis is costing us about $2.5 trillion. But it's not really the cost of money only. It costs lives, it costs productivity, housing insecurity, strain the justice system, and so many other issues. That's what we're here to talk about today. So a few years ago, as the crisis is gaining its full speed, so to speak, it became very clear that the nation needs to respond. Indeed, the nation has risen, and in many different ways. The federal government's given more money, local, state agencies are working on this. But what we quickly found is an issue of coordination and the issue of moving collective actions together. In other words, what I'm saying is while many people are acting, we're not acting sufficiently together. Next slide, please. And so in that context, there was a need for a public-private partnership to bring together the major players to coordinate and to develop collective action. So it's said by the Surgeon General that when you tackle this problem, it's like eating an elephant. Not one person can do it alone. You need a whole tribe. And in this case, we call it a portfolio approach. That is, no single policy would be enough, that we need to work together. In that context, we brought together 60 participant representation from federal agency. As you heard, my co-chair is Admiral Dzau, who's the Assistant Secretary of Health. And in fact, he's in charge of HHS opioid response. And many other federal agencies, including CDC, SAMHSA, NIDA, you name it. State and local governments, communities, provider groups, health systems, payers, academia, philanthropy, and people with lived experience. All these people coming together is, I think, a powerful collection of voices and being able to inform each other, coordinate the activity, and actually develop collective actions. So I'm very privileged to be one of the co-chairs, as you see on the slide, and I already mentioned Ruth Katz from Aspen Institute, Jonathan Perlin from HCA Healthcare, and of course, Admiral Dzau. Next slide, please. So the way we approach this is a public-private partnership. What we want to be inclusive. We want people working both in the front line and in policy area to work together. Things such a entity exists elsewhere. That's why this collaboration is so powerful. And when it came together, the participant says, let's prioritize what we need to do. And so as a result, you can see on this slide, there are 4 different priority areas. And we form working groups to address each one of them. Now, why do we choose these 4 areas? Because these are areas that we feel there are existing gaps. And also these areas that can truly bring together public-private partnership. They include health professional education and training, pain management guidelines and evidence standards, treatment and recovery services, research data, and metric needs. I'm going to show you a slide on each one of those activities. Next slide. So in the area of health professional training, we all know that doctors, nurses, dentists are on the front line. They're prescribing. And so what we found is having such an important role in countering the opioid crisis by giving the appropriate education, learning, etc. It turns out that education training is highly fragmented across the education continuum. What I meant is that in the medical profession, the medical school, the residency training, the continuing medical education, but also across interprofessional continuum, nursing, dentists, pharmacists, you name it. So the whole point of this working group is to look at the gaps, the practice gaps, and to create an action plan across the continuum, both interprofessional as well as within that profession. So there's a strategy for implementation. What's really important in this collaboration is they're working towards create a standardization, quote, across the continuum so that people know when to learn, what to learn, and being pretty much uniform across the country. There's commitment from accrediting, certifying licensure and regulatory bodies to say we adopt those informed requirements so that if you are to be in this profession, we expect you to be trained properly and to learn to be certified. So that includes AMC, ACGME, ACCME, Professional Association, and accrediting, certifying, and licensing organizations. So the first 3 involves medical school, medical colleges, graduate education, residency, and continuing medical education. And it's of course important that the educators all adopt the evidence-based criteria and programming, which will come out from this initiative. A very important issue. Next slide. The other one that's really important is to say what are the guidelines for acute and chronic pain when you manage pain? What are the evidence, particularly in prescription of opioid or also non-opioid? So this is a very important issue because, as you know, when you go, you have surgery and post-surgery, you may need a set of prescription that's pain management, which may include opioid. But if you go to a dentist for a minor procedure, you don't need the same kind of length and duration or type of prescription. So in so doing, FDA came to ask us if we can create evidence-based guidelines. And this is what you see in the report in 2019, which creates a framework to evaluate existing clinical practice guidelines, and then allows people to say, if I use the framework, well, what is the guideline for treating this condition or that condition? And we have published a report and it's being applied in many different acute pain situations. Next slide. That leads me to say that this prescription guideline is critically important and must be adopted. And that's the second output of our work stream, or the output of our second work stream. The third one, of course, is prevention, treatment, and recovery. We published a report in 2019 also to show that medication works. That is, the medication-based treatment for opioid use disorder are effective and save lives. But the problem is not available to many people who need them. Only 20% of people with OUD receive any type of treatment in a given year, and fewer receive medication-based treatment. So we feel strongly that denying access to these is delaying appropriate medication treatment for the people who need them. Next slide. So we talk about prevention, treatment, and recovery services. Because recognizing there's a significant undertreatment of opioid disorder, we need to get to make sure that everybody who needs them gets them. And why are they not getting them? Well, because of stigma and a misunderstanding of the whole issue of substance use disorder. There's insufficient incentive reimbursement options for the practitioners. There's, in fact, this problem of a continuum of care for the people suffering from opioid use disorder. And so we need to make sure all these processes not only happen in parallel, but they in fact happen in a continuum. And of course, importantly, medical social services are not integrated or coordinated, which makes it very difficult for the afflicted to get the right services. So this work stream will highlight the barriers that we see, the strategies to combat stigma, align the essential elements of continuum care, and develop framework to implement, scale, and sustain effective prevention, treatment, and recovery. Next slide. So we have published a paper from the collaborative which identifies the barriers. And in fact, there are many barriers, as you can see here, but importantly, that there are strategies to address these barriers. This paper actually presents 25 different strategies. So we hope that these strategies will be implemented so we can get to treat the people who really need treatment, prevention, and recovery. Next slide. The final work stream is, of course, research data metrics. There's still a lot that needs to be known. What works, what doesn't work, and what needs to be done. And of course, they will look at cross-cutting across the collaborative, the research agenda for each one of those three work streams I talked to you earlier. And of course, it will be informed by needs not being addressed by the other working groups as well. So these are the four work streams. Next slide. So when I sit back and ask my team to plot this together, you can see how active we are. This slide shows you the collaborator in the middle, the entities, all 60 organizations working together. You can see the four work streams and the product that I just talked to you about. It's a very impressive amount of activity done in a very short time. We've only been working together for a year and a half. Next slide. More importantly, we're not doing it in silo. This slide shows you that this is part of a cohesive systems response. In other words, while the federal government, the state government, the NGOs, the health systems, the patients, and providers all working together, we are mapping ourselves to how we connected to everything so that this is not done as a one-off, as part of a much larger system to solve this problem. And I think that's why it really shows to you, if you look at the middle, which are all the different entities across the country and working with us, planning out to look at how to connect with each other and coordinate and create a system so that we can conquer this problem of an opioid crisis. Next slide. So, as you all know, we're in the midst of a pandemic called COVID-19. And of course, the pandemic is so, shall we say, overarching that everybody's consumed with COVID-19. But we want to point out that COVID-19 impacts severely this population that we're talking about today, the opioid use disorder and substance use disorder and pain. And therefore, COVID-19 is aggravating, if you will, the situation and making this crisis even worse. Because people with substance use disorder or opioid use disorder are highly at risk and susceptible to COVID-19 because of who they are, where they live, and many of them are also homeless, but also because there's a lot of implication of COVID-19 in terms of receiving care, access to emergency care, life-saving medications, medication-based therapy, counseling, social peer support, and many others. Our patients are having trouble accessing those care and receiving the appropriate medications. And of course, chronic pain also considers high risk because of susceptibility and need for care. And there's a need for action to preserve the well-being of these individuals during the current pandemic. I can't emphasize enough how important that is because these are vulnerable individuals. And with COVID impacting our society in so many different ways, they're suffering ever more. Next slide. So we have gone to action with Liz Finkelman's leadership, with our co-chairs, and with the entire team and the entire collaborative. We've gone to say we need to put effort into addressing COVID to the population of substance use disorder. And so we have created a resource page. We have town halls. We have a statement from the collaborative. We have rapid response research agenda, webinars such as today, op-eds and publications. Next slide. So, for example, together with ASAM, we have created a webinar series. There are three. One, helping people with addiction stay connected during COVID-19, treating addiction across care continuum during COVID-19, the challenges and promising practices, and third, coordinating across the social safety net to avert a crisis among patients with addiction. Next slide. So this is it. You will be spending your day with us, hearing what everybody's doing, and I'm very proud of the collaborative and its members and our guests in all collective working on this crisis. The crisis is complex. The crisis is aggravated by COVID-19, but together we can overcome it. Thank you very much for being with us today. Thank you.
Thanks very much, Dr. Dzau. And now we'll hear from Ruth Katz.
Morning, everybody, and I'll be brief. I know we've got a big agenda and lots to cover today, but I just want to welcome everybody and thank you all for joining us, for zooming in, if you will. We know how busy everybody is, and so we appreciate your taking time to join us. Dr. Dzau has done a terrific job, as always, in teeing up the challenge that the collaborative is taking on, as well as describing the work that we have been doing over the past year and a half with our 4 different working groups. I just want to underscore how important the work is that we're doing. Right now, as you all know, we're dealing with an epidemic, the opioid epidemic, within a larger epidemic of the COVID-19. But we want to make sure that the work that we're doing somehow doesn't get lost. In fact, that we're working harder than we've been working up until now because this work is so critically important. We're very excited about today's program, especially our keynote remarks from our colleagues and friends at Shatterproof, focusing on the issue of stigma As Victor just discussed, the issue of stigma cuts across all 4 of our working groups, and it's absolutely clear that we've got to take it on in order to make real progress across the board. I also want to just take a moment to thank Liz Finkelman and her team for putting together today's program. Having now worked myself on doing a number of these webinars, they're not so easy, particularly with large groups. So Liz, thanks to you and your team for a great job. And thank you all again for being here today. And let me now turn the program over to our friend and fellow co-chair, Dr. John Perlin. John?
Well, thank you, Ruth. Let me thank both Dr. Katz, Aspen Institute, and Dr. Victor Dzau, National Academy of Medicine. I think in hearing both of their comments, there's been a tremendous amount of work accomplished. It's really so significant that I think all of us feel that we have additional work to do, particularly in an environment which, as both Victor and Ruth shared, is one where much of the oxygen in the room is sucked out by COVID. So let me just make first 3 points. For one, that this is a tremendous basis on which to start, in which to really provide guidance to a more effective health context for the care of those with opioid use disorder. And today's symposium, albeit virtual, is really one of the important mechanisms for organizing the next tranche of work, summarizing work to date and outlining next steps. And that's very much appreciated. And I'd add my thanks to Liz and the NAM staff for their hard work in that. To this point that Victor made about really the overwhelming effect of COVID making it particularly difficult for individuals with opioid and other use disorders to find care is so critically important. I think there's one thing additionally that's so very special, and that leads me to my third point, and it's really the sort of culmination of the trajectory of discussion today. And that is that the elements of a health system that's better equipped to prevent, to treat, and manage opioid use disorder is probably also better equipped to address issues such as COVID, to bring together public health, community resources, and the formal healthcare delivery system in more coherent work. And so I think this work is tremendously important in its own right because of the exacerbation for those individuals. But I also think it's important as a model for better care that really is so sorely needed as is demonstrated at this moment. So it's really in that vein that I have gratitude to not only the organizing entities, NAM and Aspen Institute, but to each and every one of you for your contributions, and very much look forward to learning with you and moving this agenda forward. Thanks.
Terrific. Thank you so much, Dr. Perlin, Ruth Katz, as well as Dr. Dzau.